Good afternoon or good morning, everybody. Welcome to the very first on-stage Q&A session live on Facebook. It's Kai Hoff speaking from the On Home Office, and today I've got the pleasure to interview a good old friend from Greece who has now moved actually to Doha, Qatar. So it's a real international event. Dr. Emmanuel Papacostas, he's the founder of the Sports Clinic Thessaloniki and the co-founder of the MIS Orthopedic Center in Thessaloniki, the leading sports medicine center in Greece. And actually now he's talking to us from Doha, where he's at the Aspetar Orthopedics and Sports Medicine Hospital, the #1 place in Qatar. So welcome, Emmanuel. I'm happy to talk to you.
I'm not only happy but also honored to be here as a guest from your Author Generation network, and being here in my home office in Doha. We are all facing this frustrating moments with this COVID pandemic. So it's quite hard to communicate, but we do have these exceptional tools that technology offers us. And after all, ON Foundation is also a new thing in terms of communicating between people and networking. And that's really an honor for me to start and kick off this this new adventure, let's say.
It's great having you on this premiere. Maybe for our guests who are joined this session, I'd like to remind you that's actually a Q&A session, which allows you to ask questions to that wonderful speech that Emmanuel gave during the first on-stage event last autumn. And we will have the chance to ask him questions regarding that presentation, but obviously also regarding himself. And I welcome all your questions. But let me start, Emmanuel. I'm wondering what actually made you become an orthopedic surgeon and choosing sports medicine?
Well, it was something like a one-way road for me. I had this sports background. In a very young age, I started together with my school commitment and everything. I started being quite active as a youngster, and being an athletics track and field athlete. Reaching out sometime later on down the line, a quite decent level in the national, at least, level in athletics in Greece. So by the time that I was in the last years of high school, and then facing the challenge of going to the university, since I had also like a medical background, my father is also a doctor, so I was kind of, as I said, it was a one-way road, as I felt right from the beginning that this is the area that I needed to be. So combining sports with medicine, and the closest, let's say, specialty in at least in Greece is orthopedics, because we don't have this subspecialty of sports medicine. So sports orthopedics was something that I was really keen on. So I started this pathway back in, I don't know, maybe before the medical school. So this was 1985, 86, something like that. 87 was my first year in a medical school.
Okay, now that explains also why you developed this expertise in that field and why you're now taking care of professional sports teams.
Yeah, okay, I think it's quite crucial for someone who's dealing with something to have maybe some extra special personal experience. So that's something that can play a positive role, of course.
And on stage, you talked about health monitoring. When did that area start, and how did you start?
Health monitoring is something very, very important in terms of everyday medicine in all specialties, and it's in my opinion, the most useful tool that you have in order to to understand what's going on with your patients, to deal with yourself in some cases, to have feedback, and to understand what went wrong, what is right, and what is closest, or let's say closer to evidence based. So you all, as in everyday situation in all professions, let's say, we need to extract data. We need to keep data, extract data, and have our own results after that. So health monitoring is a kind of let's say mathematic or technology thing implemented in health in general, in sports in particular, and that's why we discussed some months ago in this wonderful experience that I had in Zurich with the ONstage event.
Yeah, you've been in charge as the head team physician of POWER for years, and you've extremely successful with that approach. Do you want to shortly explain what you did?
It was not what I did. It was what the team did. I mean, the club itself, administration, people in the administration, the owner, of course, and all the people around, coming down to the main protagonist, which are the players. So what we succeeded and what was already, let's say, presented in this lecture some months ago was a new approach, which was new to us, new to the club, new maybe in the national level. The approach of organizing and better monitoring our people. I mean, our players and the team, in order to have better information, better interaction, and at the end of the day, better availability, which is the number one situation and the number one advantage of a coach in order to get better results. Availability of having players without facing any musculoskeletal or other problems, and they are okay to participate in full training. So this means to be well trained in a very good fitness level in order to perform the best possible way. And then it depends, of course, on other issues. But as long as you have your best players and all the players available, it's better for the team to perform.
That sounds like you've got a lot of control on the players. How do they respond to being monitored?
No, not at all. It's a kind of easy situation in terms of the data that you have, because it's something quite regular now and quite normal for every club. So, for example, these GPS vests that they use, most probably you have the experience by seeing even during the games now, all high-level clubs and athletes, especially in football, they are wearing these transmitters, which gives information to the performance guys after having analyzing the data from these GPS accelerometers, which are typically accelerometers, analyzing the load, analyzing the accelerations, the change of direction, the impact, jumps, high intensity running, how many kilometers you run, in which velocity, so many parameters that they don't do differently. I mean, the players, the athletes are doing what they're doing. So we just, without having a special interaction, we just get out this data. And this data is one part is to interact with the technical stuff in order to organize better the training loads and to see from that point and on. And this is something that which is quite technical and quite, let's say, coaching stuff. But on the other hand, we have several parameters that we can take a look And if you get a little bit deep and looked in this, you can extract very important information regarding uh, injuries that might happen. So plays a major role in prevention, and you can also better coordinate the rehabilitation if someone is getting injured at the end of the day.
That sounds very interesting. Maybe you mentioned data and evidence. Can you share with us some numbers? Did your injury level decrease when you
In
started
our
your
in
sport?
our story in our story it was yes, we use uh, not we use the same parameters that everybody is using in the area of sports orthopedics and sports medicine. For example, availability, and the number of injuries every 1000 hours of exposure, so the same epidemiological data. So it looks like even from very high quality published um, reference that we can have from, for example, from UEFA Champions League study, we know that teams that they have more than 90% availability. So this means nine out of 10 players are available all the time for the coach to select, for the manager to select. They do have better success, and they do go into um, winning titles at the end of the season. So we managed to start we before the implementation of this method, let's say, which was uh, not a really different method, but it was something like more organized, let's say. Uh, Before that, we had something like, before 2016, we had something like um, definitely no titles for many years down the line. And we had something approximately, because I was not aware of all the data, but we had something like 75, 20, 80% availability of the players. After the implementation of this method, which is not a complex situation, as I told you, but it's uh, more systematic analysis, and being all together with the team, and an interdisciplinary approach, we had more than 95% availability. And in this next coming 3 years, from 2016 until last year, we managed to win three national cups, and and of course the championship after 34 years. And just to give you another clue, it was an undefeated season.
Wonderful. Congratulations again.
Thank you. Which was not, of course, the only parameter that played a role in this situation was not, of course, the medical and health monitoring. It is, as I said, a team approach from all included, let's say, people, and everybody who was responsible, but everybody did what they needed to do. So it was initially something that conceived by the owner, made through the administration, and then came into implementation by our staff. I mean, the medical staff and the technical staff as well.
I see that other people would also like to have the same success with the teams. And I just got a very interesting question, and I read it for everybody. So good. What were the barriers or difficulties that you encountered during your efforts, as well personally as in the medical coaching conditioning team, to implement this monitoring approach? How about the budget, cooperation of the players?
Yeah. That's why I said it's a team effort. I mean, it's a situation that if you don't have the support from the administration, you cannot proceed. If you don't have the good communication with the technical staff, you cannot go further down the line. And coming from the administration part of the discussion, you need to have the means. So this means that you have to someone needs to invest on this. So investment means money. So money in this situation means not only manpower and working hours, but also means investment in technology, investment in new equipment, investment in things that can help the medical personnel to proceed in a safer way, in a faster way, in a more efficient way. So this is the part that it's usually in a team. This is the most difficult part for the head, let's say, of the medical services to convince the other parts like administration and technical staff that we need to do something in some for this to be implemented. In our case, this was not, to tell you the truth, this was not difficult, as long as it was backed in a way. When you propose something and you give your idea and you support it with data, and then it's okay. Everything can go. And at the end of the day, if someone sees the cost effectiveness, the value for money, it's you can get for this investment very easy, because if you win titles, if you go and play in Europe, if you are a successful team, you get better income. So you get the budget can balance, and not only balance, can overcome. So you have a profit.
Do you have to be an
So
international?
it is difficult. It is difficult. Sorry, to just to finalize this question. Let's say the answer in this question. It is difficult to start implementing things, but once you start and once you get things back into normality, let's say, in the way that you feel and what is established out there from wiser than us people. So I think everybody sees. So it's finally it's something that goes into trust and good knowledge.
Thank you. I think now our guest might still wonder about the budget. If I would be in charge of a local football team, could I apply it, or do you have to play? Do I have to play on international level to afford?
No, I think it's quite easy to be implemented. The budget is not out of mind. In our case, I mean, in the situation that we described before, it was a lot of other things that needed to be to be implemented as well together in terms of rehabilitation and even in some cases in facilities. Uh, but that was something that it was going to happen anyway. The different thing is that you have to invest in experienced people and in a well-structured team that can work on a good communicative skills around and interdisciplinary approach. If you don't build trust inside the team, then you cannot proceed with nothing. You can even skip, let's say, all this high-level technology in several cases. Since you have good communication inside the team, with the technical staff, with the performance team, and with the administration, of course, and all this comes around to the players, then my feeling is that what we discussed as health monitoring can be implemented as well in a normal way, let's say not in a high technology and high level situation, but can be implemented definitely. Yes.
Okay. Now we talked a lot about this entire team and the effect this training method has on the team. Now let's think about the single player. Can you use your system to personalize the training and also to maybe improve recovery from injury?
Yes, of course. After all, what is published is already in the area of rehabilitation, how you monitor the rehabilitation process and the training loads. So in terms of medical, unfortunately, we're thinking more when something happens and not before this injury happens. So what is the common how to say, the common focus of medical teams in teams worldwide is to how to better diagnose a situation, maybe earlier, as soon as possible anyway, but to focus on the diagnosis and the proper treatment. In order to monitor the treatment and the process on a daily basis, you definitely have the experience of the physical therapist, the experience of the exercise physiologist, the experience of the rehab coaches, and of course the experience of the sports doctors or orthopedic surgeons that play this role. And but if you have the ability to implement this kind of technology, like the GPS that I told you previously, you can see the load. You can see, for example, you can see the velocity that the player is moving around when he's doing his drills in the rehab phase, and you can adjust. You can say, okay, we have a hamstring injury. Okay, we know that we need to go up to this level, but we have normative data for this player beforehand. And that's the beauty of it. You have something like a data pool. Out of it, you can extract everything, and you have comparisons. You can see how this player reacted in a normal game or training situation 2, 3, 4 months ago. So this is his normal. And then how he reacts now when he's injured in a controlled situation of rehabilitation. So you can monitor the evolution, and you can use this as a criterion, one of the criteria to get him back into full activity.
Could we, as foundation, we try to develop good methods for regeneration after injuries. If we look outside of the sports world or the team world, could this technology be used for rehab after normal injuries and surgeries? For instance, after a cartilage regeneration procedure?
Yes, in my opinion, yes. And I think that we are also involved, just to give you a clue, we are also involved in this kind of approach as well, in terms of rehab and what to do and how to use this kind of input information. But yes, definitely can be not necessarily in the ones that we use in normal football or in sports. Maybe you need to do some adjustments, but I don't know. Most probably you remember during the Zurich meeting ONstage, we had an exceptional talk from a guy from Luxembourg. A fantastic idea of how can we monitor the growth of the bone with this kind of technology, which is something that we can see it in the next couple of years starting to be there. And to tell you the truth, we are looking into this in getting this information and to trying to implement into rehabilitation first, and then maybe in other areas as well.
If I ask you to guess, how long will it take until it finds its way in daily practice?
The problem. Okay, one of the issues is that in medicine, I will give you an example. Everything new that comes into surgery comes from the field, in my opinion, comes from the field of sports orthopedics. For example, if you have something like a new technique in ACL reconstruction, in anterior cruciate ligament reconstruction, most probably the first group of people that gonna test this approach are the athletes. And team doctors or consultant orthopedic surgeons that dealing with high-level athletes, they are the ones who are seeking all the time the new technology, the new evolution, and that's the situation, I think, in the global community. So most of the innovation comes from this area, at least in our field. So techniques like new techniques or new technologies, let's say, that can be implemented, I think this is not very far away. But in order to establish the scientific base behind it, it might take a little bit longer, because you know better than me that although we are quite experimental in our daily practice and quite anecdotal in most of the cases and quite individualized, we go on an individual treatment in some cases, but we are based on something which is evidence-based. So in order to implement something new, of course we can try, of course we can see some things, but in order to be evidence-based, it's going to be quite hard. So it will take from the beginning of the first, let's say, period, like starting to do things, I would say something like 2 or 3 years after that. So if something comes up next year, then it could take something like 2 or 3 years to be established.
That's promising and sounds quick.
I think, yes.
Yeah. We received another question regarding timing, how long it's going to take. Once you've applied this approach, health monitoring approach to your team, how long does it take to see success?
It depends on the communication between the groups. I mean, the groups that they form the whole team. So my feeling is that my experience is very positive. So it takes some months, maybe 2 or 3 months, to see the results, to start seeing and compare what you have now compared to what you had previous year in the same period. But it's not only, and it's definitely not only the medical part. It's mostly the acceptance that you get from the technical stuff. I always say, and it's not my quote, it's it's a common sense that football players are not injured by the medical stuff. although administration, reporters, journalists, people around, everybody wants to blame someone else. So typically, when you are injured because you're overtraining, and you are overtraining because you don't control yourself, or your coach is quite heavy and pushes you a lot, okay, I can say something, okay, guys, control the load, and maybe you're gonna get injured. But when, in most of the cases, when an athlete is injured by other reasons, except medical consultation or physical therapy approach. So it's something that you need to control in a way. So you need to have good communication. You need to understand what the team wants, what the player wants, what the coach wants. But they also need to understand that they have on their side good medical staff, good physical therapy stuff, good exercise physiology, good stuff, that they are all together trying to control the situation for the benefit of the athlete. That's something which is not very easy, and especially in this high level demanding sport level that is in some cases we might be let's be realistic, some of the players, and in some of the cases they are considered something like expandables. So okay, we can push. If I get injured, I get injured, whatever, no problem, we go with the next player, which is something that I don't understand, but there is this kind of mentality in some clubs.
But if your theory is correct, these clubs cannot be successful.
Yes, typically they're not. I can give you several examples, not by knowing, of course, the data, but understanding what's going on in terms of okay, we all are exposed to information from websites, from reports and everything. We can see high level, high profile Premier League clubs that they spend a lot of money in contracts and players, and they are not having success. And if you take a deeper look, you're going to see that they lose a lot of money because of a lot of injuries, that they do not produce, they do not perform.
Are the players aware of these differences between the clubs? For instance, if
I
they
think
change club, would they ask for the health monitoring and the medical stuff?
yes, there are a lot of players, in my opinion, that they have a high level of awareness and in this situation, and they understand that they need to be fitter, they need to be not overtrained, not undertrained. They need to be in the best possible situation in order to perform. And to be honest, in the vast majority of teams around Europe, at least, they are, and this is expanding worldwide. This is in the same line now. They all understand that athletes are not expandable. So, in order to get the best possible performance of the team, you have to have the best possible, uh, um, let's say, amount of players available. So, and not only that, they need to be in the best possible situation to perform.
Mhm.
But in order to give something like an answer to the previous question about how long this takes to see the results, as I told you, it depends on the interdisciplinary approach and how good is the communication between the groups in the team. But you can see the difference if this is implemented. You can see the difference even from the first months, maybe 3 to 6.
Okay, good. You've proven that very successfully with PAOK. Now, being in Doha, do you have similar plans?
No, I changed it completely. In terms of here in Aspetar, which is in your preface when you started this communication, you said the leading hospital in Qatar. It's, in my opinion, it's the leading hospital worldwide in terms of sports injuries, sports orthopedics, and sports medicine. And this is proven by the patients that are coming here in order to get treatment, by the very high level expertise that is uh, communicated worldwide in terms of um, um, references, in terms of publications, in terms of good work that is happening here. And at least in my knowledge, is the only hospital worldwide where everything is under one roof. Everything regarding sports is under one roof, and it's only dedicated for this. We are, for example, in orthopedics, we don't do fractures, we don't do hip fractures, we don't do total knees or total hips. We only do sports-related injuries. So this is a different line in terms of, okay, being a team physician most probably played a role for me to come here. But most probably because I managed to get some extra exposure and some extra experience in this side. So, okay. But the main thing is that here I'm doing a total different thing. Not a total, but okay, I'm focusing only on the surgical uh, treatment of sports-related injuries, and the plan is, of course, to develop in our line of expertise to develop this um, cartilage approach and to implement orthobiologics and orthogeneration in this area, starting from this area and expanding worldwide.
Fantastic. I see at the moment there's no more questions. So a personal question: when you are sitting on the side of the soccer field watching your team, do you also
Mhm.
do health monitoring on yourself? How about your adrenaline level?
Um, the less experienced you are, yes, you definitely need it. But as the time passes by, you get used to it. And at least for me, it was fantastic to live this last season when we managed to get everything, literally everything, in terms of what was missing from the team. I mean, the championship title, the cup, undefeated, as I said before. So in terms of what someone in my line of field would like to feel with the team, this was the top. This was Mountain Olympus from that point on. Of course, we didn't reach Mountain Everest. Okay, that's that's another thing. But yes, you definitely need, in some cases, health monitoring, especially even if you are not in the bench, even if you are in the watching the game from the TV, you definitely need, if you are kind of a sports person and you are uh, uh, committed in what you feel, then yes, you feel your heart beats and your temperature is rising. Although now you don't have to say anything about your temperature with this coronavirus thing, so we need to avoid everything.
Yeah.
You have to cover yourself.
Thanks for these personal insights. Maybe one last question for our young community. There's many young orthopedic surgeons who think about becoming team physician. What would be your advice to them for their career?
In my opinion, this is the best school that anybody can have, even if it's not a success. What I mean is that you never understand, you never know what is really going on out there in the sports area. You cannot claim that you are a sports doctor if you are not in some period of your professional life, if you are not involved with a team. You have to feel exactly what you said. You have to feel the bench. You have to feel the dressing room. You have to feel the training center. You have to feel yourself in your body. You have to feel um, uh, what exercise means, what training means, what reaching your limits means. So if you are in a hospital operating on patients, then it's okay. It's fantastic. But in my opinion, you cannot say that you're a team physician after that or a sports doctor after that. Uh, definitely not. So the best possible university, the best possible curriculum that you can follow is to be attached with a team, not on a I am in my office base. So okay, whatever happens, I can go back and forth, and I will examine the patients and give my advice. You have to be there in the dressing room, in the bench, in whatever are the conditions outside in the training center. You have to commit yourself at least for some period of your time.
Thank you very much for that advice to our young community. I think this is a wonderful conclusion of this premiere. I'd like to thank you so much, Emmanuel, for that exchange. And I'm looking forward to meeting you again live. Also, I'm enjoying this very much.
Hopefully. Yeah, thank you.
Yeah,
Although this arrow in the back, in your back,
yeah.
is quite far away from where are you established and where is my home country as well. But it's not that far. The problem is that we have to stick into electronic communication now, not physically, and this stands for our families as well, which is the most important thing to understand, that we are missing our families, they are missing us. So okay, you are quite lucky that you are around. We are not, but this is because of the situation, and we have to be strict on this in order to calm down everything, and hopefully we're gonna win this game as well, and we're gonna win this title again.
Yes, let's hope. And we as a foundation, we will do our best to bridge the distance as well, and we will continue the series. And I invite all
Yeah,
our audience today
it,
really to join, to share their feedback. And I'm looking forward to more of
from
these.
from my side, if I may say so, I would urge all young orthopedic surgeons, sports medicine physicians, physiologists, biologists, everybody who's a member or not a member, join the network, join the foundation. You can have exceptional opportunities in order to enhance your level. There are several scholarships and fellowships that can be uh, a major advantage in your work. So everybody needs someone to guide and to help in this situation. So this is something that uh, it's one of a kind. So it's also a family matter in terms of good communication and personal face-to-face communication. So that's why I feel also very comfortable to be part of this family. Thank you for the honor.
I think that's a perfect closing. Have a good day, everybody.
that's the time. That's the time now that we finish up and.
Now we
Okay,
should
but this
push
is something that
together
you know.
our papers and we start private conversation. Yes.
Yes. Okay, thank you again. So we leave the floor to the administration, and
Yeah,
I guess if there are any other questions that might rise up through Facebook or through other means, we can deal with them. Of course, definitely sometime later on.
we will make sure that the questions find you. Have a good
Thank you.
day and stay
Thank you.
healthy. Bye.
You too. You too.